All right, welcome back to Sensible 2020. I'm Seth Adler of Cannabis Economy. It is my pleasure to host this entire event. Hosting this particular session is Robert Hofmann, this particular session being various strategies for drug decriminalization. Robert?
Hi, everyone. Welcome to the panel. I'd like to give some short introductions for my panelists. But first, my name is Robert of he, him pronouns, and I am a U.S. Movement Building Fellow for Students for Sensible Drug Policy. I'll keep it short and let the other folks take it away, starting with Ryan.
Hi, I'm Ryan. My pronouns are he, they. I run READ's Students for Sensible Drug Policy chapter, and I'm also the Student Harm Reduction Coordinator for our Community Safety Department. And I'm working with the Drug Addiction Treatment and Recovery Act campaign in Oregon. So I'll talk about that a little bit more later.
Cool. Then we can go with Jules.
Yeah, my name is Jules Hodge. My pronouns are they, them, el. I am the president of the Students for Sensible Drug Policy chapter at the University of California, Santa Cruz, and I'm one of the founders of Decriminalize Santa Cruz.
Cool. Okay, great. And then Ben.
Thank you. My name is Ben Ruddell. I'm the Director of Criminal Justice Policy at the American Civil Liberties Union of Illinois, here to talk about the Reducing Barriers to Recovery campaign in Illinois.
Great. Okay, well, let's just move right along then to our first discussion. We've talked on a couple of calls about our various strategies towards different types of drug decriminalization. And part of that being, a lot of conversations going on in the network on how to best end the war on drugs and decriminalize substances in whatever way different communities see fit. So I'll just start off with Ryan. We'll go Ryan, Ben, Jules, and just talking about your campaign a little bit in regards to your different type of drug decriminalization. Let's do like about a 2-minute snippet, maybe a little bit over, but try for 2 minutes. Yeah, just go for it, Ryan.
Yeah, so the Drug Addiction Treatment and Recovery Act, otherwise known as IP44, is a proposed ballot initiative in Oregon that if it gets on the ballot and passes, what it'll do is it will decriminalize possession of small amounts of scheduled substances. So, and that varies by substance. So like for 1 gram of heroin, 1 gram of cocaine, that would no longer be a criminal penalty. That would be kind of the equivalent of a traffic violation, what's called an infraction. And so that would result in a $100 fine, which you can get waived if you go to a consultation at an addiction treatment center. This bill also sets up low barrier access treatment centers all around Oregon, and it will fund that using cannabis tax revenue. So all cannabis tax revenue in excess of $45 million will go towards funding these new low barrier addiction treatment centers. And that's basically, that's the main gist of it. There's some finer points of it which we can get into, but yeah, for just like the very short introduction, that pretty much sums it up.
Sweet. Okay, cool. Then we can go with Ben.
Thanks, Rob. So reducing barriers to recovery is what some might call a de-felonization initiative. Essentially, it involves the reclassification of criminal penalties from felonies to misdemeanor for simple possession of what we call user quantities of different drugs, and similar to Ryan's proposal, that those amounts vary based on the drug, but the penalty would be reclassified to a misdemeanor, which means the person can't be sent to state prison. Also importantly means that they won't have a felony conviction on their record, which is so often disqualifying when somebody goes to apply for a job or an apartment or admission to college. There are a couple of other components to the bill. It's a legislative initiative in the Illinois General Assembly. The bill would create a framework for diversion of folks who get arrested for drug possession or most other misdemeanors to get their behavioral needs assessed and have a treatment plan created if appropriate. It's not a mandatory treatment program, but rather designed to off-ramp people from the criminal justice system into community-based services that they might need. Finally, there's a retroactive component that would retroactively reclassify the penalties of people who were convicted of felonies before what we're hoping will be a new law goes into effect, and allows expungement of records for people who have those felonies so that they can move on with their lives and not continue to bear the burden of this misguided policy for the rest of their lives.
Cool. Okay, thanks, Ben. Then we can go to Jules for the last point, and then we can get a little bit more into the conversation.
Yeah, so what Decriminalize Santa Cruz did, we made the possession, cultivation, and use of entheogenic plants and fungi the lowest level priority for law enforcement in the city of Santa Cruz. We managed to pass that through the city council back in January. So now we're starting to focus on other substances. Right now, I'm working on, it's all sort of on a standstill for right now, but our next steps are decriminalizing the sale of cannabis by people without a license. And after that, we're working on a few things like LSD and ketamine as the next baby steps for us.
Gotcha. All right, well, thanks everyone for the introduction. We'll go a little bit more into the conversation then. And part of this, we're really talking about, and the panelists and I have generally talked about this before on calls, but we all have a similar general goal towards going towards, among other things, decriminalizing all substances as a real foundational sort of stopgap for the war on drugs from these low-level arrests. I mean, particularly for communities of color and other surveilled and targeted communities. So within that, I just wanted to get a sense of the current strategy for getting, I mean, for the two of, or I guess Ryan and Ben with those campaigns going on at the moment, and then Jules with the other sort of various substances, and then also re-decriminalizing sales of cannabis. Amid the public health crisis we have going on right now regarding COVID-19 and the, I mean, obviously devastating public health outcomes of that. So we'll just go, I guess we'll start with Jules and then go the other way around this time, mixing it up a bit, and then seeing, you know, how this public health crisis has changed your folks' plans.
Our strategy was to start going, well, we had to choose to do we couldn't all go for all drug decriminalization all at once. Our town, we're known for being very progressive. It's made up of a lot of like sort of faux progressives, like people that, you know, the kind of sort of hippies that think that psychedelics are medicine, but still give a lot of crap to the harm reduction coalition in town that's been trying to get syringe exchanges set up for a long time. So we had to decide to do baby steps. We tried to take bigger steps that eventually had to get scaled back because there was a recall going on in town that was going to get rid of some of our progressive city council members. We knew that if we started out smaller, it would be harder to repeal those steps when those 2 members did get recalled, which did end up happening. And now what we're doing since COVID-19 is happening, we're focusing more on how to educate people, get people more aware of what the entheogens can do and how beneficial they are, so that so that people can see the benefits of what these baby steps have been and will feel more comfortable when we take larger steps in the future.
Cool. Okay, and then Ben?
Thanks. So, you know, the goal of our campaign, and I should emphasize that our proposal would reduce penalties for all drugs, and that's a really important principle for our campaign, especially because it's a legislative campaign, and in legislatures there's often a strong desire to get the easy win, get the incremental win, carve out things that are less palatable, which in the case of our bill are drugs like heroin, fentanyl, methamphetamine. This is our campaign's been going on for more than 2 years now, so we're in the second year of having a bill, And last year we were having legislators ask us to carve drugs out of the bill, and we refused to do that. But we have, as far as the goals of our campaign, they're kind of threefold: de-incarceration, reducing the number of people imprisoned and facing a lifetime of collateral consequences of a felony record because of a conviction for drug possession; racial justice, because we know about the outsized impact that drug enforcement has on communities and people of color; and public health, because we know that prohibition is a public health disaster. And as far as the frame of our campaign, we're really emphasizing the public health frame, because that is what we find appeals most to legislators. And it will be interesting as the principles of public health become more known to people, as we hear from public health experts every day in the midst of this pandemic. It will be interesting how that impacts our campaign going forward. In the near term, it's impacted our campaign because we're not able to be in Springfield. There is no session until some indeterminate time in the future. So it's set the timeline back realistically a year, because nobody really thinks that if and when we do go back this year, that proposal like this will be taken up. Rather, I think people think it'll be legislators will go back, pass a budget, do things that are essential or time sensitive, and call it a day. And so we're really looking to 2021 because of the COVID-19 epidemic. But it will be interesting because this epidemic, or this pandemic rather, has really brought to the fore the issues, so many of the issues that underlie our campaign, and the plight of people who are incarcerated and their vulnerability to this virus, as well as the special vulnerability of people who use drugs. And so I think a lot of we're working with a coalition, and a lot of those advocates are currently doing work as we've hit the pause button on our campaign, doing work to get people out of jails and prisons, to hopefully reduce the impact of what's already turning out to be an outbreak in Illinois jails and prisons. It's already begun, and people are already dying. And then focusing on some of the harm reduction advocates in our coalition are trying to make sure that the people that they care about and serve are not dying, because they're at increased risk during this time as well.
Gotcha. All right, great, thank you. And then Ryan with the last point.
Yeah, thank you. So very similar to what Ben just said, IP44 is about decriminalizing all drugs across the board. We're not picking and choosing specific less palatable less palatable substances from a public view to sort of single out and leave out. So basically, with regards to how COVID-19 has impacted our efforts, this is a ballot initiative, so it's dependent on getting a certain number of signatures in order for this to appear as a measure to be voted on the 2020 ballot. And so we need to collect 112,000 signatures of registered Oregon voters by July 1st in order for this to appear on the 2020 ballot. We're very close to that goal. We're about 8,000 shy right now. Obviously, in-person signature collection efforts have been impeded. That's no longer feasible to pursue. So the way we've adapted is we now have an online petition that registered Oregon voters can download, print out, sign, and then mail in, and so that they can have their signature counted that way. And so we're currently in the process of reaching out to folks, to potential supporters, letting them know about that option, about the petition, and following up with them and requesting that they actually do print that out, sign it, and mail it in, because that that is the type of thing that, you know, people may be sort of inclined to click on 1 second and not kind of fully follow through with it. So we're just reaching out to people via text right now, and hoping that we're still optimistic that we can get this on the 2020 ballot. And our research shows that if it does get on the ballot, Oregon voters will likely favor the measure. Similar to what Ben said, we're really stressing the public health element of this. That's kind of what Oregon voters see as the most valuable aspect of this measure, even more so perhaps than the decriminalization component is the increased access to treatment. And so we're really stressing that. And with regards to just like our overall goals, yeah, like as Ben said, reduced incarceration and also just a paradigm shift for how the state responds to drug use. So, you know, this fundamental shift from seeing it as an issue of criminality to a public health concern. So we're really just trying to make that like kind of shift in the public consciousness happen and be reflected through policy. I should also mention, I should have said this when I was talking about the initiative when I was introducing it, but there also is a de-felonization component to it. So for amounts of drugs that are not covered by the decriminalization, I think it's like for 1 to 5 grams of MDMA, for example, 1 to 8 grams of cocaine, those get busted down from a felony charge to a misdemeanor charge. And Ben already kind of explained the practical impact of that, the fact that people will not have these overly penalizing records that prevent them from getting, you know, housing, access to jobs, access to public services, like all these horrific consequences from this record. So yeah, I just want to mention that there is also a defelonization component to it. But yeah, with regards to COVID, it's
sorry, Ryan, I'm gonna have to give you like a 40-second sort of wrap up just because we're a little bit over. So if you just take this part like in like 40 seconds, then we can go on to the next one.
Yeah, definitely. I've pretty much said my piece already. Yeah, it's definitely proving a challenge, but we're optimistic that we can get it on the 2020 ballot.
Cool. Okay, great. Thanks, everyone. So I wanted to take a little bit of time. I'll just really take a little bit of time to go over SSDPs, and this is a U.S. policy position specifically, but for limited drug legalization in terms of the various decriminalization efforts going on at the moment. Just to give, you know, sort of, and this is a very limited sense of what, you know, so SSDP Global in general does or recommends around decriminalization or de-felonization. So the main part of that position being that we believe that all drugs should be decriminalized and following that regulated according to their risks. But insofar as like the campaigns going on at the moment, it's heavily encouraged for folks to, and we only give global organization endorsements to campaigns that are specifically, that aren't one by one decriminalizing substances unless it's cannabis or something that's specifically targeted in a community. So like cannabis, for example, being something that is heavily targeted, obviously like communities of color very heavily targeted by cannabis arrests. So that would be not something included in that. But for that reason, and in terms of, you know, the sort of way that we're looking at ending the war on drugs, specifically in our coalition, we don't give formal endorsements to like decriminalize nature campaigns or decrim Santa Cruz, among other things. And chapters are able to do what they want, clearly. But I just want to give that small sense, and we can talk a little bit about that in the last discussion point here, which is mainly, and we'll go, I guess, Ryan, Ben, Jules, back the other way. I'm talking about, in general, your longer term goals, maybe like a 5 to 10 year goal, actually 10 to 15 year goal for drug policy and drug policy reform, and where this current campaign fits into that. For about like roughly 2 or 3 minutes each. I know that's kind of a lot to ask, but keeping it like as succinct as possible. What are your, this can be like a chapter or organization for ACLU of Illinois, for example. But yeah, so long-term goals and how does this campaign fit in?
Yeah, so long-term goals, I think just echoing what you said, full decriminalization of all substances, not having criminal penalties for anything drug-related, really, or for possession at the very least. And then looking beyond that, also just increased access to resources related to people struggling with problematic or chaotic substance use, lower barriers for access to things like addiction treatment and also harm reduction services. And then another long-term goal is reparation to the communities that have already been so targeted by drug policies already. And I think that might be an area where the initiative I'm working on right now kind of falls a little flat. Obviously, I think it's a huge step forward to push for decriminalization, but in terms of repairing the harm that already has been done, I think that's something that we can look to for the future as sort of a long-term goal to keep in mind, and just be cognizant of the fact that our current efforts, although very important and while they will be a milestone, still aren't necessarily as oriented towards that goal as hopefully future efforts will be. I would say decriminalization across the board, increase access to treatment, and repairing the harms that have been done to communities by targeted drug policies.
Excellent. Okay, thanks, Ryan. We'll go to Ben next.
Thank you. The ACLU of Illinois and the ACLU more broadly are opposed to the criminal prohibition of drug use, drug sales, would, in terms of our long-term vision, look to a day when nobody is made a criminal or incarcerated or otherwise facing criminal penalties because of their involvement with drugs. Whether that's attainable within 10 to 15 years or not, I don't know, but that's where we think we need to go. As far as our strategy and how we get there, this is obviously an incremental step that takes down the penalties and increases the access people to treatment and helps to repair some of the harm of past convictions. But it's not a full decriminalization bill, so it doesn't even get us to where Oregon is now, and they're seeking to take the next step. I think that would be the if we're successful in this step, we'd like to take that step next, and at least for these low-level possession offenses, get rid of all criminal penalties, felony or misdemeanor. But in the long term, even decriminalization is an imperfect strategy, because what we see now in the current epidemic of addiction and overdose is that it's driven by drug poisoning, by fentanyl, and all kinds of dangerous substances that people may not even be aware that they're using. And as long as it's the unregulated market that's supplying people with their drugs, those problems are going to persist. So I think that's why why regulation in the longer term is where policy needs to go.
Cool. Okay, and then we'll go to Jules for the last bit, and then go into some final comments.
Yeah, so the long-term goals for our organization are sort of difficult to see, because there are people who have very different opinions on what the end goal should be. I am for all drug decriminalization, but we do have a few of our core members who don't believe in that. Also, some of the people that do have the more hardcore beliefs that we should go further, they're graduating, and a lot of our membership is going to be gone in a year, including myself. So it's really hard to see where this is going to be in the future. But what I do see is everyone is starting to branch out into different things. We have people focusing on the education so that the people that were against our resolution in the beginning regarding just the entheogenic plants and fungi, so that the people that were against it start easing up because they start to get educated more. We have people working with the Harm Reduction Coalition in town so that we can get people easing up on that front. And we have people working with another harm reduction organization in town that helps to provide people with fentanyl test strips and drug checking and such that can help ease the problems on that front that are caused by drug criminalization. But as for decriminalize Santa Cruz itself and how we're going forward with policy, there isn't really a clear end goal.
Okay, gotcha. Let me just do a little time check here. It seems like we're doing really well on time, so thanks everyone for that. We have roughly 4 minutes from when I end this sentence. So you know what, we'll do it. We'll do a Ben, Jules, Ryan end out round. I haven't let Ben go first in these. So any final comments? I would recommend if there's any actions that folks can do. I mean, I definitely know there's going to be folks listening in Illinois, Oregon, California. So anything you want to final comment, and then, you know, like an action that folks can help with, or some website to go to, anything like that.
Sure. I would encourage you to go to the website of the ACLU of Illinois and look at our criminal justice reform page. Reach out to me or someone else at our affiliate about how you can get involved in the campaign. If you live in Illinois, it's always good to contact your legislator to let them know that they to urge them to support House Bill 2291, which is the bill number. I would maybe hold off on that right now while the pandemic is going on, because they're hearing about a lot of other things and they may not have a chance to vote on this bill until next year. But get in touch with us and get involved in our campaign. We have monthly coalition meetings and calls that you can get looped into wherever you are. And when it's time to vote on that bill, then we can activate folks to contact their legislators to support it.
Great. Okay, Jules?
Yeah, if you want to get involved with Decriminalize Santa Cruz, follow us on Instagram or Facebook at decriminalize_Santa Cruz. We're always looking for new people to help us, and I'd love to bring in more people that can help us figure out how we can go further with this, or who want to continue this after all of us leave.
Cool. Okay, and then Ryan, and then I'll end with a little piece, and then we can skedaddle.
Yeah, so I would say for folks interested in supporting IP44, the most tangible thing you can do is, if you're registered to vote in Oregon, definitely go over to yesonip44.org, download the petition, sign it and mail it in, and then your signature will be counted and that'll help us get it on the ballot. If you know anyone who's registered to vote in Oregon, sending them that link or just letting them know that that is an option, that's a tangible action that they can take to supporting this initiative, that would be, I think, the most concrete, helpful thing that folks can do to support us right now.
Great. Okay, thanks, Ryan. I'll just put in a little piece here while we still have time. First, while this panel is mainly US focused, there is a lot of global work going on around various types of drug regulation, even safe supply work, like real, hardcore drug regulation and drug decriminalization campaigns going on in other countries, Ireland being one that comes to mind at the moment. If you want to send any emails to ssdp@ssdp.org, it'll be forwarded to one of the outreach staff. I have about half of the US chapters, but if I'm not the person that responds, my colleagues Luis and Roisin will get back to you from that email. So if you want to be involved in any of those or just any SSDP campaigns, there's a lot more going on. But I think these folks are both, or all very great representatives of these campaigns, and definitely looking forward to seeing how all these things shake out and how we end the war on drugs together. So with that, I think we can just head out here, but thank you, Seth, for helping record this. Thanks to all the panelists. Now we're gonna go to Q&A.